Over 2 billion people worldwide are living with excess weight. The condition costs the global economy trillions of dollars annually, and it currently stands as the fifth leading risk factor for global mortality. This video is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a medical professional regarding your specific health needs. For decades, society treated weight gain as a personal failure or a temporary lack of discipline. Clinical science now recognizes obesity as a complex, progressive, and destructive chronic disease. We measure this condition using the body mass index, or BMI. When the calculation of an individual's weight relative to their height reaches a score of 30 or higher, the body enters a clinical state of excessive fat accumulation. To treat this disease effectively, we must move past moral judgments and examine the biological origins of how the human body gains weight. The biological bias toward storing fat often begins before birth. If a developing fetus experiences maternal overnutrition, their cellular programming shifts, hardwiring the body for hyper-efficient fat accumulation later in life. This inherited susceptibility is compounded by specific genetic mutations. Variations in the FTO and MC4R genes can disrupt the brain's ability to process hunger signals, making it difficult for individuals to recognize when they are full. These ancient biological survival mechanisms are now colliding with a modern food environment centered on highly processed, high-calorie meals. At the same time our diets shifted, the nature of daily work changed. We moved away from physically demanding labor toward sedentary office environments, causing a massive drop in daily physical activity. Then comes the physiological trap. Chronic stress and poor sleep trigger a hormonal cascade. Cortisol spikes, the hunger hormone ghrelin surges, and the body develops leptin resistance, a state that chemically drives overeating and lethargy. The idea that weight loss relies entirely on willpower is scientifically inaccurate. Individuals with obesity are often fighting deeply entrenched biological programming and an environment engineered for fat storage. This accumulated mass exacts a heavy toll on the body's structural framework. Excess weight can increase the absolute peak downward force on a knee joint by over 40% with every single footstep. Over time, this mechanical overload accelerates cartilage breakdown, leading to osteoarthritis, altered gait patterns, and a loss of physical independence. Central adiposity also presses inward. Fat deposition around the upper airway and chest wall physically restricts lung expansion, causing ventilatory instability and conditions like obstructive sleep apnea. White adipose tissue acts as a highly active endocrine organ. It constantly produces and releases its own hormones into the bloodstream, impacting physiological functions across the entire body. When fat cells become enlarged, they begin secreting pro-inflammatory cytokines. This initiates chronic, low-grade systemic inflammation, spreading directly to the liver and pancreas. That inflammation drives a secondary wave of diseases: type 2 diabetes, fatty liver disease, and dyslipidemia, where small, dense LDL cholesterol aggressively accumulates in the arteries. The patient is trapped in a dual-front assault. Painful immobility restricts their physical movement on the outside, while an inflammatory cascade destroys their vascular system on the inside. All of these compounding structural and chemical burdens eventually converge on a single organ, the heart. To supply oxygen and nutrients to a massive increase in adipose tissue, the heart must drastically increase its total blood volume and baseline cardiac output. Forced into this unrelenting workload, the muscular wall of the left ventricle physically thickens and stiffens, a structural change known as left ventricular hypertrophy. This thickened muscle is now forced to push blood against the intense resistance of arteries, heavily narrowed by cholesterol-driven atherosclerosis. The clinical results of this internal pressure cooker are severe. Patients face high blood pressure, dangerous heart rhythms, and a vastly increased probability of suffering a heart attack. When heart failure occurs in an obese patient, it is rarely a sudden accident. It is the climax of a burdened pump breaking under systemic load. Relieving this pressure does not require reaching an arbitrary weight target. Losing just 5 to 10% of your initial body weight significantly reduces cardiovascular and diabetic risks. Aerobic exercise serves as a frontline treatment. Regular training strengthens the diaphragm, increases your maximum rate of oxygen consumption, and improves oxygen delivery to tissues. Resistance training is equally vital. Building muscle mass creates an active metabolic engine that consumes energy even when the body is at rest. Then there is non-exercise activity thermogenesis, or NEAT. Simple daily movements, like pacing while talking or standing at a desk, burn a massive amount of cumulative energy over time. Movement operates as a precise medical intervention necessary to relieve the mechanical stress on the joints and the physiological burden on the heart. On the nutritional front, heart-healthy frameworks like the Mediterranean or DASH diets focus on minimally processed foods to help directly reduce vascular inflammation. During weight loss, consuming high amounts of protein and fiber is required to protect your lean muscle and bone mass while the body burns through fat stores. Recovery also requires treating the mind. Prioritizing 7 to 8 hours of sleep and utilizing cognitive behavioral therapy are proven clinical strategies to lower stress and quiet the hormones that drive cravings. Overcoming the cascade of obesity requires shifting from a willpower model to a professional medical model. This involves a coordinated medical response, where doctors, dietitians, and mental health professionals work together to treat the biological roots of the disease. If you found this breakdown helpful, please subscribe to the Explainer channel. We'd also love to hear your personal experiences with managing weight and heart health. Share your story in the comments below.